I'd like to talk to you about dementia, specifically how to respond when your family member is showing signs of hallucinations, delusions, or paranoia as a result of a dementia diagnosis. So when someone hallucinates, they see or hear things that nobody else does. Voices may be heard, people may be seen who are not really present, or strange and frightening noises may be heard. Delusions are ideas that are not based on reality, but which are thought to be true by the person that has the dementia. Paranoia is characterized by unrealistic beliefs, usually either of persecution or of grandeur. People with dementia may believe that others are out to get them, or that they have superhuman powers even. And then sometimes the people with dementia will often become quite suspicious and hoard or hide things because they believe someone is trying to take their possessions. Let me give you a few examples. So Peter is looking out the window in their kitchen, and he just is in awe of the cows grazing in their front yard. Except there's no cows there, and there never have been cows there. Or Rose is convinced that their cleaning lady has stolen some of her jewelry, and it can't be located, and Rose fires the cleaning lady without warning. So what are the possible causes or triggers of hallucinations and paranoia and delusions? Sometimes it can be a result of sensory changes, like hearing or vision diminishing. Sometimes medications or an actual physical illness may be a cause. Often it's an unrecognized environment or new caregivers that are coming into the home. Even inadequate lighting can play a role, or a disruption of routines. And sometimes, often the removal of items from the person like money or jewelry can evoke some of these types of behaviors as well. So how do we meet those with some strategies? Well, I always suggest meeting with your spouse or family members or parent's physician just to review some of the medications and schedule a hearing and vision test just to make sure everything's on par. And also seek a medical evaluation for illness or infection or a urinary tract infection and that type of thing, because you want to rule those things out first. When a person is suspicious, look for the lost articles and remind her where often valuables are stored. And don't scold them for losing or hiding things, and try to keep a spare set of frequently lost items if that's possible, just to make sure you have some on hand. And try to investigate some suspicions that might actually be true. Always make sure to increase the lighting in a room and use physical touch as a reassurance, because that's comforting to an individual. So in the case of Peter and the cows, one strategy would be to validate his vision, but don't actually ask him to expand on what he sees. So responding with something like, "That's great, Peter, you've always really liked cows, they must remind you of the farm," that's enough. Generally speaking, unless the hallucination is causing distress to either you or the person with dementia, there's really no reason to try to convince them that the cows aren't actually in the yard, as this way he will see it to be argumentative and likely to cause a disagreement. When he seems ready to offer an activity or to go do something else, that's when you sort of distract him and go underway. Rose's case is a little trickier. So in her case, I would listen to her concerns and treat them genuinely. Look for the missing jewelry. Think about the hiding spots that she's used in the past. And if you're not able to find the jewelry, then offer an activity as a distraction. For instance, we've been looking for a while, let's go get a cup of tea and take a break. And you may or may not return to the looking activity after the tea. If the jewelry hasn't been located, investigate the suspicions that she has, because they could be true. Could the cleaning lady have taken her things? She actually could be a victim in this case. But if the jewelry is found and was likely hidden by Rose in this case in the first place, perhaps exchanging it for similar costume jewelry and having more replacements at the ready is in order. And of course, if somebody was fired or accused unrationally, then it's important that a letter of apology be written to accommodate for that. It's always important to remember three things when thinking about a response to behavior as a result of a dementia. Think about the physical needs, whether those are being met. Think about the environment that the person is in, and think about any type of interactions the person is having. And please keep in mind that the best advice comes from those with lived experience of Alzheimer's disease or related dementia. So I encourage you to please get in touch with your local Alzheimer's Society for more information. Thanks.